Good morning, everybody. My name is Dr. Mariz Abdo. I'm a lecturer of pediatric endocrinology. Today, we're going to be talking about hypocalcemia. So, what's the definition of hypocalcemia? It's a laboratory and clinical abnormality. And in children, it's defined by having a total calcium level below 8.5 milligram per deciliter, while in full-term infants, it's below 8 milligram per deciliter, and in preterm infants, it's below 7 milligram per deciliter. Regarding the etiology, it depends on the PTH level. So there are causes of hypocalcemia with low PTH, causes of hypocalcemia with high PTH, and there are miscellaneous causes. Regarding the causes of hypocalcemia with low PTH, it could be due to genetic, autoimmune, or other causes. The genetic causes include George syndrome, a mutation interfering with the production of PTH, which could be autosomal dominant or autosomal recessive inheritance. Or the HDR, which presents with hypoparathyroidism, deafness, and renal anomalies, or there could be mutation in the calcium sensing receptors and related proteins, which is an autosomal dominant inheritance, or due to mitochondrial diseases. The autoimmune causes of hypocalcemia associated with low PTH include autoimmune polyglandular syndrome type 1, and other causes includes removal of the parathyroid hormone during thyroid surgeries. As regards the hypocalcemia causes due to that are associated, with high PTH, it could be due to decreased level of vitamin D, due to deficient intakes, sun exposure, decreased absorption, or liver disease or renal disease, or it could be a vitamin D dependent rickets, which is due to alpha hydroxylase deficiency, or there is a hereditary resistance to vitamin D. And also causes of hypocalcemia that also associated with high PTH includes pseudo hypoparathyroidism, which is a sort of end organ resistance. Regarding the miscellaneous causes of hypocalcemia, it includes Hungry bone syndrome, osteoporosis, sepsis, and several illnesses, hyperphosphatemia, pancreatitis, alkalosis, and hypomagnesemia. So what's the clinical picture that the patient presents with? So the patient, it depends on the calcium level. So the patient could come in like manifest tetany or latent tetany. The manifest tetany is the frank picture of tetany. It includes carpopediospasm, irritability, paresthesia, seizure, twitches, and laryngismus. Latent tetany, the patient presents with hyperreflexia, toxic sign, Trousseau sign are positive, hypotension, and arrhythmias. Regarding the investigations that should be done to the patient, they include laboratory investigations and imaging. The laboratory investigations include calcium, phosphorus, alkaline phosphatase levels, magnesium level, parathormone level. The imaging includes X-ray of bones and CT of the brain. Management of patients of hypocalcemia includes the administration of IV calcium gluconate 10% at a dose of 1 milliliter per kg, and it should be administered slowly over 10 minutes. And the administration also of IV magnesium sulfate 10% at a dose of 1 milligram per kg. And the patient should be started on oral calcium and vitamin D in appropriate doses from the beginning. Thank you.